Hi, Dr. C back with you. This is lesson 28. In this lesson, we're going to be covering the Florida Food, Drug, and Cosmetic Act, which is Chapter 499 in the Florida statutes. This will cover book pages 153 through 158. So as you can see in the introduction material on page 153, the Florida Food, Drug, and Cosmetic Act is Chapter 499 in the Florida statutes, is enforced by the Florida Department of Business and Professional Regulation, DBPR. So it's not actually enforced by the Board of Pharmacy. It primarily applies to drug manufacturers, repackagers, wholesalers, and others involved in the distribution of drugs and food and cosmetics and others. However, there are some provisions in here that can impact pharmacies and pharmacy practice, so I want to hit some of those highlights just in case they happen to show up on the MPJE exam. So let's talk about some permits that may apply to a pharmacy that you may have to get from DBPR. The first one is a retail pharmacy wholesale distributor permit. This is required if you have a community pharmacy that's engaged in any wholesale distribution of prescription drugs. So if you are a pharmacy and you are distributing rather than dispensing to other pharmacies, between two pharmacies, two community pharmacies, or to a hospital, or even to a physician's office, you need to have this particular permit. You will notice on the bottom of page 153, it says that you can use this permit as long as those distributions from your pharmacy don't exceed 30% of the annual purchases of your prescription drugs. If you exceed that, you'd have to get a regular wholesale distributor permit. So this allows pharmacies to do some limited distribution without getting the full distributor permit from DBPR. Instead, you get this retail pharmacy wholesale distributor permit. It's only available to retail community pharmacies, however. Some additional permits issued by DBPR include a complimentary drug distributor permit. Now, most pharmacies aren't involved in this, but this is for any business or person that is doing distribution of drug samples. Remember, in a community pharmacy, you're really not allowed to have drug samples. However, if you are involved in that business in any way, you have to have this complimentary drug distributor permit. The third one is kind of an interesting one, is a medical oxygen retailer. This is a permit that allows businesses or entities to actually distribute and dispense medical oxygen, which is a prescription drug technically. Now, a pharmacy doesn't have to get this permit if maybe you have a home health care business and you also dispense medical oxygen, but any other entity that is not a pharmacy would have to have this medical oxygen retailer permit. So as the study tip there tells you on page 154, it's one of the few examples where a technical prescription drug can be dispensed by an entity in Florida that is not actually a pharmacy. Another example where some prescription drugs can be dispensed or sold by an entity that's not a pharmacy is this veterinary prescription drug retailer permit that DBPR has. So this allows sales of prescription veterinary drugs, but only veterinary drugs. They can't have any human drugs at these facilities. To dispense these drugs based on an order from a veterinarian, so it looks like a pharmacy, but these are not pharmacies, so they can't dispense any human drugs, only veterinary drugs. And then the final miscellaneous permit is on page 155. And that's a healthcare clinic establishment registration. So this one is kind of interesting, and I actually recall this one coming up when I was working at Cardinal Health. At Cardinal Health, as a distributor, we could only sell prescription drugs to someone or an entity that was licensed to receive them. And oftentimes when physician offices wanted to purchase prescription drugs, we had to sell them in the name of an individual physician. And sometimes those physicians worked in a large clinic and they wanted to use those drugs for the entire clinic, but legally we could only sell to an individual physician, and we had to sell, the invoices had to be in the name of that individual physician. So some of these larger clinics wanted to be able to share the drugs within the clinic, this is the purpose of this type of registration with DBPR. It allows the purchase of prescription drugs at one location that maybe employs lots of different physicians and gives them access to those drugs for the clinic. Again, I don't think this would come up on in a pharmacy practice, but if you're ever involved with a healthcare clinic, that is an option you can have to purchase drugs for the clinic and not in the name of an individual practitioner. So on page 156, I picked out some selected violations of Chapter 499 that could apply to a pharmacy. The first one is adulteration and misbranding. I didn't include the details here because the adulteration and misbranding provisions here are very similar to those under the federal law, which we previously studied. But there's some other ones you should be aware of. Refusing to allow a DBPR inspector to come into your pharmacy, because even though your license is with the Board of Pharmacy and you don't have a license with DBPR, they are allowed to inspect any establishment in which drugs, devices, or cosmetics are being stored. So they do have access to your pharmacy for inspection. Sometimes they'll work together with the Board of Pharmacy on an investigation, but just be aware that that's another government entity that could be coming into your pharmacy. Purchasing drugs from an unauthorized person or entity. You want to make sure that any wholesaler or manufacturer that you purchase from is licensed to distribute drugs in Florida. I do see pharmacies getting in trouble for this by purchasing drugs from entities that are not authorized in Florida. And same on the other side, if you sell or transfer drugs to unauthorized persons or entities. That was a big one for us at Cardinal Health when we sold to pharmacies in Florida, because I will just tell you, DBPR is very, very particular that the name of the entity we're selling to, the address has to match exactly what is on the license. Otherwise, they would call that a violation. Other violations, charging a dispensing a fee for dispensing a sample medication. Now, again, you should not usually have sample medications in your pharmacy, but there are some exceptions to that we talked about. So if you are dealing with samples, maybe in a physician's office or an indigent clinic or something like that, you can't charge a fee for dispensing sample medications. And then finally, you see there, failure to acquire or deliver those transaction history information or statements, all that transaction data that's required under the Drug Supply Chain Security Act that we talked about. So here we see Florida is recognizing the Federal Drug Supply Chain Security Act. Okay, on the bottom of page 156, and then mainly starting over on page 157, we have the Florida Cancer Drug Donation Program. So I included this because the previous versions of the NPJE competencies actually was very specific and mentioned drug cancer donation programs. There are actually two different drug donation programs in Florida. I cover this one here because it is in Chapter 499 because it is run by DBPR. The other program is not in Chapter 499, so we'll see that in a later lesson. So make sure you don't get these two mixed up. The Cancer Drug Donation Program, as I mentioned, is administered by Department of Business and Professional Regulation. The purpose is because cancer drugs are very expensive, and sometimes these patients may pass away. So why waste those medications? So you need to know who can. The purpose is to provide these donated drugs to patients at no cost. You should know who can be a donor under the program. In the Cancer Drug Donation Program, notice that on top of page 157, actually a patient or a patient's representative can actually donate cancer drugs or supplies if the drugs have been maintained within a closed drug delivery system. So if the patient's at home, that's not a closed drug delivery system. But if they were in a hospice, inpatient hospice facility, perhaps in a nursing home where the nursing home maintains possession of the drugs on behalf of the patients, those all would qualify as a closed drug delivery system. And then healthcare facilities, nursing homes, hospices, or hospitals with closed drug delivery systems can also serve as donors, drug manufacturers, pharmacies, as well as physicians. Who can be the recipient of these facilities, what they call a participant facility, are institutional Class II hospital pharmacies. Now you're going to see some issues here because a lot of these laws were passed when all hospitals had Class II permits. A lot of them now have a Class III permit, as you'll see, but I think those are probably grandfathered, were intended to be included in, but the problem is the Class III permit was created later after these laws were changed, and the laws or the rules for these programs haven't really been updated. But I don't think anybody would have any issues when we say it's a Class II. Well, it probably includes Class III because those are hospitals as well. Notice that community pharmacies are not included in this program. It's only for hospital pharmacies. You should be familiar with the requirement. The drugs have to be in the original unopened and sealed containers or in a tamper-evident unit dose packaging. So sometimes they went to a nursing home and they were prepackaged into unit dose. As long as it's tamper-evident and the pharmacist reviews the information and can tell that it's not been adulterated or misbranded, they're probably good to be donated. The other requirements are it can't be within 6 months of expiration dating, so we don't want drugs that are just getting ready to expire as well. And notice in number 7, as I mentioned, a pharmacist does have to inspect the drugs to make sure they haven't been tampered with or are mislabeled. So drugs that do qualify for the program can then be dispensed to other patients. You can't charge for those drugs other than for a handling fee to cover the cost of preparing and dispensing the drug. You can charge, I guess, a small dispensing fee, but not for the actual cost of the drug. So as I mentioned, in the next chapter, we're going to cover a different type of drug donation program, and I want you to make sure you compare and contrast those, as that one does not allow donations from patients, and that one community pharmacies can participate in. So make sure you keep these two different types of donation programs separate.